Hey guys, have you ever heard of the peptide Tesamorelin? Well, this is one of the most talked about in the field of healthy aging, wellness, injury prevention, recovery, sleep. Literally, I've been on this one since May and I'm absolutely loving it. But before we get started, I do have to say this is for educational purposes. Before you start any peptide therapy program, make sure you consult with a qualified healthcare professional. So what is tesamorelin? Well, tesamorelin is a growth hormone releasing peptide, which means it actually tells your brain, or specifically your anterior pituitary, to secrete growth hormone. And growth hormone, if you watched any of my other previous videos, is a game changer when it comes to building muscle, burning fat, when it comes to healthy aging, longevity, sleep, like I said, all of it. And why I think this is important is because so many of us have just been led to believe that as we're supposed to age, we're supposed to decline, we're supposed to just fall apart, we're supposed to rust. And I'm here to tell you that's not true. You can age gracefully. I just turned 61 a couple of days ago, and I'll tell you what, I've never felt better in my life, even back to when I was 19 and in my early 20s competing in bodybuilding. I feel as good now as I did back then, and I really believe it's because of tesamorelin and the other peptides that I'm on. Now, I will say there are other peptides such as CJC1295, which is also a growth hormone secretor. I tend to like this one better, and I did a video on this. You could check out some of my previous ones where I talk about tesamorelin really being more of a punch when it comes to igniting that pituitary gland into making more growth hormone, which once again is really a game changer when it comes to anti-aging, metabolism, healing better, sleeping better, and virtually any other metabolic process in the body is always enhanced when growth hormone levels are normal and supported. So let's dive a little bit deeper. Tesamorelin has been clinically proven to really reduce visceral abdominal fat. And why is that so important? Because the more abdominal fat that you have, you increase your risk for metabolic syndrome, you increase your risk for stroke, you increase your risk for diabetes, inflammation, insulin resistance. Any of these problems, as I've mentioned in previous videos, really cause a whole cascade of effects that lead to chronic disease. So by reducing that deep belly fat, you really reduce your risk for so many other chronic illnesses. Another key benefit is improved body composition. So while losing fat, your body is increasing lean muscle mass, which is ideal for those who are really looking to tone, increase athletic performance, and really also have healthy aging. Another key benefit is how it affects your brain. Early studies show clinically that tesamorelin improves memory, mental clarity, and cognitive performance, especially in aging adults. Another key factor is metabolic health. By increasing your body's sensitivity to insulin, helps you burn sugars better, which reduces insulin resistance. It also helps with lipid metabolism. These are all key markers as we age as to whether we're aging healthy or not, and reducing markers of metabolic syndrome. And finally, with improved HGH levels, users report better sleep, better healing and recovery, especially after doing exercise, when many times people will feel tired for days on end. So it helps you with that. It also helps with greater energy and resilience. So your workouts really have a lot more impact. So guys, tesamorelin to me is one of the ones that you always want to be using, or at least from time to time. Kick it back in. Use it maybe 6 to 8 months and then go off of it and then go back on it again. I will take this probably for the rest of my life because I've been seeing amazing benefits from it with increasing, once again, lean muscle mass and burning that visceral fat, which is dangerous. Of course, metabolic syndrome, even when it comes to fatty liver disease. So tesamorelin is one of the ones, like I said, I will always be taking. And if you're looking for more information, we have lots of educational information in our link tree. So just go to my bio, click on the link tree, and it'll bring down different topics of information that you may find extremely valuable. Well, guys, I love and appreciate you. This is Dr. Nick. I'll see you on the next video. God bless.